Hello, we are the SMARS Group. Today we are presenting a project to Northford Medical Center on the early identification to prevent prolonged hospitalization. We are a team of compassionate professionals striving to work together to optimize positive patient outcomes. Our team works well together and we value respect, equality, trust, and communication in all of our endeavors. We will uphold these values while working with Northford Health Center to assist with meeting the recommendations brought forth by the Sunderland Local Health Integration Network Task Force to decrease ALC days. Our presentation will focus on recommendation number 1 in the report from the task force. Utilize standardized risk assessment and screening tools for the early identification of people in the emergency department at high risk for delayed discharge. The time is now to focus on this recommendation to eliminate funding impact and penalties related to increased ALC days. Alternate level of care is used to distinguish patients who are no longer in the acute phase of illness. ALC has significant impacts on patients, such as patients' access to care, safety, and quality of life. It also is costly to the healthcare system having non-acute patients occupying beds allocated to the medical patients. Most of the ALC patients are over the age of 80. The Canadian population is getting older, and there are more elderly or aged people living than ever before. This number is only going to increase, and because of this, there is a larger population needing long-term care options. Northford Health Center is a rural 137-bed facility delivering a range of acute, post-acute, outpatient, and diagnostic services. This hospital is one of the many struggling to manage the growing pressures in regards to the ALC bed occupancy. This in turn affects the funding and prevents our ability to provide acute care services. In 2008, a task force was implemented to address the issue and impact of ALC. This task group recommended that all hospitals in the region implement a series of recommendations to help address the ALC issues. There were many recommendations made by the task force in regards to fixing the ALC issues. Our group feels that the early identification of patients at high risk for prolonged hospitalization is the key. This is a cost-efficient plan as we will be utilizing existing screening and assessment tools. The only added cost to your organization would be the initial education and implementation of the tool. Focus on the early identification of ALC patients or patients who are at high risk for ALC by implementing a standardized admission risk assessment tool. The standardized risk assessment tool will allow for the early identification of patients who are at high risk for the ALC designation, and thus allows for the early implementation of services and utilization of resources from other members of the interdisciplinary team. The tool will be utilized by all staff triaging a patient from admission to hospital to admission to a unit within the hospital. All members of the interdisciplinary team will receive an education and training of the risk assessment tool, as well as education regarding the proper utilization of services and resources from the other members of the interdisciplinary team, as well as community resources and supports. This education will allow for better patient outcomes by providing staff with the knowledge and the tools in order to assess their patient's risk for ALC designation, as well as the knowledge on what resources are available and necessary for their patients in order to facilitate a more thorough, organized, and faster transfer or discharge to the appropriate area for the patient's specific care needs. In a study provided by Canadian Family Physician, results show that by providing early assessment and transfer to a transitional care area rather than an inappropriate placement, hospital costs decreased and ALC patient outcomes increased due to early implementation of care more tailored to their needs. By utilizing this type of research, the team is confident that the implementation of a standardized risk assessment tool for ALC patients will provide positive patient outcomes. Lists of 5 phases to be completed within 1 year. Phase 1 is to be completed within 4 weeks and includes weekly meetings with ER staff and the team to review current screening tools and ALC data. Development of education presentations and delegation of support staff or super users would also be included in this phase. Phase 2 is to be completed within 4 weeks, and it includes the approval of education presentations for subgroups, setting up the delivery of 2 4-hour sessions for subgroups to create super users who could be experts in utilizing the screening tool, finalizing poster and delivery when ready and available, approval of short presentation, and distribution via email. Phase 3, lasting 3 months, we would have super users promote the tool use. Super users would be there to assist with the implementation and the use of the screening tool, collect completed tools daily to follow compliance. We would have a meeting with all team members to evaluate the assessment tool, the completion, compliance, and its effectiveness. In stage 4, for additional 6 months, we would collect completed tools weekly and assess for completion and compliance. We would compare admitted patients and completed assessment tools. In stage 5, 1 year after the first meeting, we would have an evaluation meeting that includes a pre- and post-evaluation. Choosing the SMARS group to implement the early identification risk assessment tool in your facility will ensure the following benefits: timely and appropriate placement of patients or clients, and improved bed flow by freeing up acute care beds. This will ensure that your funding levels are maintained and your organization does not accrue penalties associated with increased ALC bed occupancy. On behalf of the SMARS Group, I would like to thank you for considering our proposal to assist Northford Health Center's mission to meet the unique needs of each and every patient.